Hello and welcome to Med4Care. I am Dr. Care and today's topic will be dysuria. Let's find out together what it is. Dysuria consists of a diuresis disorder in which we witness the perception of pain, burning, or discomfort while urinating, defining a picture of general difficulty in urination. Dysuria is a very common disorder of diuresis in the population and is often a consequence of urinary tract infections, many of which are of an uncomplicated and transient course. In other cases, however, difficulty to urinate can be the sign of a more serious lesion of the urinary tract. As mentioned, dysuria, which can be described as a reported and global difficulty in urinating, is a very common phenomenon in world health, showing a prevalence of about 3% of all adults over the age of 40. Among all types of infections, dysuria is most often determined by a picture of acute cystitis, due to the ascent of pathogenic bacteria that settle in the bladder wall. Dysuria can be ascribed to two broad categories from which it derives: urinary tract infections and non-infectious urinary tract diseases. Non-infectious causes include obstructive lesions of the urinary tract, trauma from the external body, benign prostatic hyperplasia in men, and some types of cancers, such as prostate cancer and urothelial carcinoma of the bladder. Most often, however, it happens that difficulty to urinate arises as a consequence of an infection of the urinary tract, more frequent in women than in men, due to the shorter anatomical length of the urethra and the vaginal bacterial flora very often altered by improper use of antibiotics. Pathogenic bacteria, among which uropathogenic Escherichia coli stands out as the main infectious agent of the urinary tract, reach the urethra and bladder via the external urethral meatus, due to contamination of the perineum, manipulation of unsterilized bladder catheters, or for sexual intercourse without first washing the contact surfaces. Once they have gained access to the bladder, the bacteria adhere to it through the adhesins, often resulting in a picture of prolonged irritation and inflammation. The contact of urine with the inflamed bladder walls and the stimulation of the sensory and algagen receptors disseminated in the bowel activate the perception of pain, discomfort, or burning during urination, often forcing the individual to stop urinating. Dysuria, although not constantly accompanied by a real sense of pain or discomfort, is perceived by the patient as an obstacle to the normal process of urination, which entails a global difficulty in expelling urine. In these terms, if urine is emitted in drops due to the excruciating pain emitted during urination, we speak more properly of stranguria. If the difficulty is felt with bladder spasms and suprapubic pain, we could instead speak of bladder tenesmus. Sometimes, patients with difficulty to urinate complain of still perceiving a residual amount of urine still present in the bladder and not expelled with urination. In this case, this condition would be referred to as a sensation of incomplete emptying of the bladder. When dysuria arises as a result of a symptomatic urinary tract infection, fever, nausea, and lower back pain, and some specific urinary tract disorders may occur, such as polyuria, for example, urine emissions in small but very frequent volumes, or terminal dripping when urine flows in drops after finishing urination. Among the specific disorders we can also find nocturia, in which there is a tendency to urinate at night interrupting sleep, and finally the poor urination flow with a slow or intermittent flow of urine. To make an accurate assessment of a suspected case of dysuria, the following clinical steps should be observed. During the urological visit, the specialist doctor, through the anamnesis, obtains salient information about the patient, including his overall health status, the presence of any chronic diseases in progress or the predisposition for family diseases, as well as the list of drugs used in the course of possible therapies. Finally, coming to the problem in place at the time of the visit, the doctor proceeds to ask the patient to carefully describe the extent of the discomfort felt during urination, noting if the difficulty in urinating occurs with each urination and at what stage of urination occurs. Subsequently, also making use of the inspection and physical examination, the doctor evaluates the state and possible distension of the abdominal region and the pelvic region, also proceeding to search for any points of tenderness, which could signal the presence of an injury. Irritative or obstructive in place. In elderly patients, it is also necessary to fully investigate the nervous function and the physical examination of the central nervous system, since, in these cases, dysuria is often accompanied by partial alteration of cognitive abilities, with dullness and mental confusion. The doctor may deem it appropriate to better investigate the patient's condition by prescribing first-level examinations and, if necessary, second-level examinations, in order to identify the causes underlying the symptomatic manifestation of the urinary tract. The most commonly prescribed laboratory tests are blood tests, looking for any signs of infection. A chemical, physical, and microscopic examination of the urine or urine culture with an antibiogram is also prescribed to detect, in the case of a urinary tract infection, the bacteria responsible for the infection and the most suitable therapy to fight it. The optimal management of the patient with difficulty to urinate must take place on the precise identification of the underlying cause, as well as on the scrupulous investigation, including through instrumental tests, of any suspected lesions affecting the urinary tract. If at the base of the dysuria manifestation there was a urinary tract infection, it should be treated according to the type of bacterium that triggered it and according to the nature of the symptoms accused. Generally, quinolones are less used today than tetracyclines and aminoglycosides. Together with drug therapy, surgery is used for malformations or obstructions affecting the urinary tract that can cause dysuria, and, at the same time, a diet therapy is often assigned that involves avoiding those foods that can cause irritation to the urinary tract, such as caffeine, alcohol, and chili. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med4Care.